The National Security Council convened this morning and officials agreed to consider what reciprocal measures might be necessary. They said the Japanese government, without consulting South Korea, has taken action that is unreasonable. The NSC added that Seoul is strictly managing the situation through its scientific and transparent quarantine system, while Tokyo is losing the trust of the international community because of its passive response to the virus. And meanwhile, Seoul's Foreign Minister Kang Kyung-hwa summoned Japanese ambassador to South Korea this afternoon to complain about Japan's travel restrictions. The Japanese envoy Koji Tomita made his way into the foreign ministry just a few minutes ago. Seoul's top diplomat is to lodge a formal complaint against Japan's decision to tighten entry restrictions on travelers from South Korea. Late Thursday night, Japan's number 2 envoy to South Korea, Hirohisa Soma, was summoned to explain what had prompted the move. Japan announced Thursday that non-Japanese travelers from South Korea will first have to, quote, wait at designated facilities for 2 weeks. The measures start Monday and will run until the end of this month. Visa-free entry will also be suspended until late this month. Now, on to the latest COVID-19 situation here in South Korea. The country reported more than 500 new COVID-19 cases in the past 24 hours, bringing the total to nearly 6,300. The southeastern city of Daegu continues to have the most number of patients in the country, with over 4,600, followed by the surrounding Gyeongsangbuk-do province with almost 1,000. The death toll has reached at least 42. So far, over 100 people have been released from quarantine after making a full recovery. About 22,000 people are still being tested for the virus. Now, as the coronavirus continues to spread across the globe, Western countries, including the UK and the US, are also starting to face an uphill battle to contain the outbreak within their respective borders. Our Kan Young-hoo reports.
The UK has reported a total of 115 confirmed cases of COVID-19 and its first fatality from the virus. The person was an older patient who had underlying health conditions before testing positive for the virus.
In the sense that we're still, Sam, in the contained phase, though now our scientists and medical advisors are making preparations for the delay phase. And so
Prime Minister Johnson's spokesperson also said it's now highly likely the virus is going to spread in a significant way. The U.S. has also seen a spike in its number of confirmed cases. According to the U.S. Centers for Disease Control and Prevention and other reports, there have been at least 200 confirmed cases in the U.S. Washington State has reported 70 patients and 10 deaths, the biggest figures from a single state so far. California has declared a state of emergency after confirming the state's first coronavirus death.
But really, truthfully, it's a whole-of-America approach. And this week, President Trump and I and members of our task force have been meeting with industry leaders to ensure that we have all of the resources.
To combat the outbreak, the U.S. Congress on Thursday passed an $8.3 billion emergency spending package. Kan Young-hoo, Arirang News.
The United States is holding off on blocking flights from South Korea or Italy despite the coronavirus outbreaks there. It will, however, implement heightened medical screening protocols for passengers from the two countries. Acting Deputy Homeland Security Secretary Ken Kuchileni says this is in part due to the two governments being, quote, so aggressive in accommodating the medical requirements of having a successful screening system set up. He added that the U.S. has been seeing, quote, great cooperation from the two countries. He also said the U.S. is just not as close to China as Korea or Italy. The World Health Organization says there are encouraging signs out of South Korea, where the newly reported cases appear to be declining. The comments come as the WHO's Director General previously said South Korea was among the greatest concerns outside of China when it comes to the virus. Our Lee Seung-jae reports.
Earlier this week, the head of the World Health Organization named South Korea as one of 4 nations that are of greatest concern when it comes to the COVID-19 outbreak. However, such comments were tinged with a fresh sense of optimism on Thursday regarding the current status in South Korea.
We see encouraging signs from the Republic of Korea. the number of newly reported cases appears to be declining, and the cases that are being reported are being identified primarily from known clusters.
However, with other parts of the world seeing more and more confirmed cases, the Director General called on every country to act with speed, scale, and clear-minded determination, saying the epidemic can be stamped down with a collective, coordinated, and comprehensive approach that engages the entire machinery of government. The WHO chief also raised concerns that some countries have not taken the current outbreak seriously enough or have even decided there's nothing that can be done. He stressed the outbreak is not a drill. He warned the worldwide COVID-19 outbreak doesn't just threaten countries with weaker health systems, but even high-income countries should expect surprises. Lee Seung-jae, Arirang News.
Post offices and branches of Nonghyup Hanaro Mart have started restricting face mask sales to 1 mask per person per day. Branches in Seoul and most of Gyeonggi-do province will not sell any masks this weekend as they are being redirected to other regions. According to Hanaro Mart officials, this reduction in mask sales will continue until a system is established to prevent customers from making duplicate purchases. Pharmacies nationwide are currently allowing people to buy 2 masks a day, but this will change to 2 masks a week from next week. Customers must show their ID to purchase masks at pharmacies. Tired and understaffed, health officials in Daegu and Gyeongsangbuk-do province have been battling the virus for over a month now. To learn what it's been like on the front lines, our Lee Kyung-eun spoke with one of them at a triage center in the city of Andong.
This triage center in Andong, Gyeongsangbuk-do province, is just an hour's drive from Daegu, the city hardest hit by the COVID-19 outbreak. Since February, Dr. Kim Ji-hwan has been working at the center, fully kitted out in protective gear.
I'm currently using 2 suits per day, one before lunch, one after lunch, and yeah, I always get marks from facial masks, and yes, we get sweaty and we smell pretty bad in this uniform.
Working from 8 a.m. to 10 p.m., Kim receives roughly 100 visitors a day. He's seen a drastic surge in patients in recent days, with most of them linked to the religious group Shincheonji, which is connected to many cases in Daegu and the surrounding area.
The numbers are changing every day, but last time I checked, it was about 69%. More than 80% of visitors came today, were sent for lab testing today. The percentage is high because we are testing every single member of the religious group in the city.
But Kim's role goes beyond testing itself, as the medical staff also treat the emotional pain of the citizens.
People are scared, and those patients with symptoms and fever, they were afraid that this might affect their family and their work. So we're trying to calm them down.
In the midst of rising patient numbers, Kim, who is from Daegu, is worried about the situation in the city and what his family and friends are currently going through.
Medical staff in Daegu, they're having about 4 hours of sleep every night. Medical staff getting infected with coronavirus. I heard that about 50 doctors and 200 nurses are needed.
Despite the crisis, Kim and the community are staying strong.
We're trying our best to fight against this disease, and people are staying strong. And hopefully, we'll be able to overcome this. Hopefully, maybe this month or before the summer comes.
Lee Kyung-eun, Arirang News.
Now, citizens are coming up with ways to raise money for those affected by the coronavirus outbreak. Our Kim Bo-kyung tells us how people are trying to make a difference.
Donations by celebrities and companies might make the headlines, but ordinary citizens are also doing their part to help those suffering from the outbreak. To raise funds for those in need, college students in South Korea are joining together and encouraging each other to donate money. The students opened an open chat room on mobile messaging app KakaoTalk and are sharing information on how much money they have raised so far.
We have joined together to raise money, hoping COVID-19 outbreak can pass sooner. And although the money we are raising might seem small compared to celebrities' donations, we hope what we're doing now can be the starting point of a nationwide donating culture.
When they reach their target of around $8,000, they will decide which organization to give the money to so that the donation can go to those who need it. They say they will keep fundraising until the outbreak ends and are trying to find new donors.
We have already contacted influencers in our universities, and by using other media platforms, we're trying to get others to participate.
Not only college students, but people across the nation are donating to charities that are helping those suffering due to the outbreak. Hope Bridge, the Korea Disaster Relief Association, says more than $52 million have been raised so far for its projects related to COVID-19.
Lots of citizens send us messages when they donate. Most of them say, cheer up South Korea, or we can overcome this if we work together. Even BTS fans have sent us the money from their refunded tickets when the group's concert was canceled.
Already, around 700,000 items have been sent to Koreans evacuated from Wuhan and to patients in South Korea. Hope Bridge thanked citizens and encouraged them to participate more, as citizens' goodwill can make big difference. Kim Bo-kyung, Arirang News.
Now, we've been reporting all week about the shortage of protective face masks in South Korea. And to help more people get hold of something to cover their mouth and nose, volunteers from around the country are getting out their sewing machines. Our Park Se-young has more.
The people on these sewing machines are hard at work, stitching up handmade cotton face masks. The hands behind these masks belong to volunteers from the Saemara Women's Association. Amid a shortage of masks in Korea, the volunteers have gathered with their own sewing machines to make free masks for the needy. And while they were slow at first, they are getting quicker with time.
They are all volunteers for the Saemara Women's Association. It was very difficult and slow in the morning, but we're doing fine now.
These cotton masks come with a pocket for filters, which means they can be used multiple times by changing the filter. The masks made using KF94 certified filters will be distributed to welfare facilities, along with guidelines for preventing infectious diseases. Using materials supplied by the Busan City government and the Saemara Women's Association, the 30 or so volunteers are looking to make 10,000 masks in about 10 days. With research showing that cotton masks with static filters are effective in blocking the virus, the local government is considering supplying more filter fabrics. Park Se-young, Arirang News.
Okay, that is all the news that we have for you at this hour. Join us again at 5 p.m. for more Arirang news. Until then, goodbye.
The novel coronaviruses are spreading all over the world. To prevent the virus from spreading further, it's essential to attend to personal hygiene and take preventive measures. Rule number 1 for preventing the infection.
Wash your hands thoroughly in running water with soap for at least 30 seconds. Rule number 2, wear a mask.